everybody, this is Marise Frangie again. We're continuing with the series from the book Women Heal, and I'm so grateful that Teresa and Margaret are joining me for the second episode also. This is a real blessing. Thank you so much, ladies.
Oh, you're welcome.
It's good to have you back with us.
Thank you.
So today we're going to read from the section about previous miscarriages. We will begin by reading the physician's comments from Dr. Thomas Hilgers. When a woman experiences a miscarriage, she is often told that it is nature's way of handling problems, that in some way it is natural and normal occurrence. However, every miscarriage results because for one reason or another, the human reproductive system is not working properly. In cases of recurrent miscarriage, there are certain things that have been discovered as the result of the use of the Creighton model system and NaProTECHNOLOY that allow for successful evaluation and treatment to be undertaken. For example, it has been found that women who have recurrent miscarriage often have limited mucus cycles. This is a biological marker that is identified with the use of the Creighton model system. It identifies a significantly reduced production in the amount of cervical mucus at the time of ovulation.
In addition to the above, it is not at all unusual for these women to experience premenstrual spotting, 3 or more days of spotting prior to the onset of menstruation, and or tail end brown bleeding, 2 or more days of brown, black bleeding at the end of menstruation. These signs observed as women track their cycles using the Creighton model system provide meaningful information to her and to the physician regarding what the underlying problem might be. Most of the time, these problems are caused by underlying hormonal dysfunctions. They can be evaluated by a thorough, targeted hormone profile and a series of ultrasound examinations done around the time of ovulation. The ovulation patterns in these women are often abnormal as well, and they can be identified in this fashion.
An additional factor that is common in women who have recurrent miscarriage is endometriosis. This is a condition where the cells that normally line the inside of the uterus get out onto the outside of the uterus. These are called endometrial cells, thus the name endometriosis. These cells get into the uterus, tubes, ovaries, and other tissues in the pelvic area and produce an inflammatory toxin which is detrimental to fertility. In studies done at the St. Paul VI Institute, over 85% of patients with recurrent spontaneous abortion have been found to have endometriosis. In addition, many of these women also have underlying hormonal and ovulation-related defects, as previously discussed. When these problems are adequately evaluated, the endometriosis is properly treated. We would recommend surgical treatment of endometriosis, and the hormone problems are properly addressed. The miscarriage risk can be reduced significantly, although it cannot be completely eliminated. The overall success rate at St. Paul VI Institute for a successful pregnancy following recurrent miscarriage is 80%. And that's published in the Medical and Surgical Practice of NaProTECHNOLOgy, St. Paul VI Institute Press, Omaha, Nebraska. In addition to the above, once pregnancy occurs, it is supported with progesterone, the main hormone that supports pregnancy, and sometimes human chorionic gonadotropin, or HCG. This latter hormone has been shown to have an important effect on decreasing uterine irritability and reducing miscarriage rates.
I was thinking as we were reading this, like how many women might be watching, listening, who've gone through miscarriages herself or know women who've gone through it and they were not given answers. And look at Dr. Hilgers giving us here many reasons why these miscarriages are happening.
Right. And so often, women experiencing 2, 3 miscarriages before the doctors will even begin to treat, and quite often they don't really begin to look at what the problem is. They just try to maintain that pregnancy. Or in my sister's case, they just said, keep trying, there's nothing wrong with you.
We lost 2 babies second trimester, and they were both early second trimester. And when I learned about the Creighton model system and noticed also that as a young girl I had endometriosis, probably I had painful periods, and my mother would say, here's a water bottle, take a warm bath, things along that line back in the early 70s. And I also had the tail end brown bleeding, and it was an eye-opener when I was at EP1. By that time I was old, as I say, my ovaries probably had cobwebs on them by then. But it was just eye-opening what could have been done. I had never heard of NaProTECHNOLOY in 2006, and yet it had begun 30 years before. So that is part of what inspires me to want to keep going out and teaching this around the world. And yet, in my area, there's still that many have never heard of it.
Yeah. I wonder how many miscarriages and how much heartache would be prevented if more doctors really go through this to help women understand why these miscarriages happen and prevent them from happening.
We actually had a recent woman report to me here in Fort Wayne. She had a full-term birth and a miscarriage. And when she was miscarrying the second baby, she went to her physician here in town, and he said, we wait for 4 or 5 of these before we do anything. Mm-hmm. These. He called her baby these. She was horrified and left that office not to return. So she didn't have an answer, and they were going to wait for more before they did anything. So you nailed it.
It's crazy. It's crazy. There was, if you remember back in January, I interviewed one intern in South Carolina, and she shared a story about how she was having, and she told the doctor she needs progesterone, and he did not give her the progesterone. She ended up miscarrying that baby because the doctors didn't believe that they can prevent this miscarriage from happening. It's crazy. So the story we're reading today is titled, Through NaProTECHNOLOY We Have Twin Sons, written by Donna. My husband and I both agree that Dr. Thomas Hilgers and the St. Paul VI Institute are a gift and miracle for couples struggling with infertility or miscarriage. We feel very blessed to have worked with him and NaProTECHNOLOY. We had always wanted a large family, so when my daughter was 1 year old, I became pregnant. I had no difficulties with my first pregnancy, so we were not anticipating any problems with my second. When I was around 6 weeks pregnant, I began spotting and my pregnancy ended in miscarriage. My doctor told us that miscarriage were common and that we could conceive again in 6 months. We waited the 6 months that he had advised, and then I became pregnant for the 3rd time. That was in October 2001.
I began spotting around my 6th week of pregnancy again, and we feared the worst. Once again, this pregnancy ended in miscarriage. My doctor was hopeful and told us that there was most likely something wrong with the baby, or it was just plain bad luck. My husband and I were not satisfied with this answer, and we asked if there was any testing that we could do. He told us that there was no need to do any testing until I had 3 miscarriages because it probably would not happen again. He said that we did not need to wait this time to conceive, and that most likely everything would be okay the next time. In December 2001, I became pregnant for a 4th time. My husband and I were extremely nervous that we would lose another baby. Around 7 weeks into my pregnancy, the spotting began, and we were devastated when we lost another baby. Our doctor told us that he would run the standard test involving our chromosomes and blood types. We were hopeful that these tests would give us answers, but they did not, and neither did our doctor. We were shocked when he again told us that it was most likely just bad luck again. All of the tests came out showing no reason for the miscarriages, so he told us to try again. My husband and I left his office in shock and sorrow, knowing that there had to be a reason for our losses, but we didn't know where to find them. We decided to trust our doctor, and we felt that maybe he was right, that it wouldn't happen again because the test showed that there was no reason for the miscarriages to be happening.
It bothers me so much that doctors, men of science, would just accept bad luck as a reason for miscarriage. Like, how could you just say it's bad luck? Like,
that's right.
You've gone to medical school, studied science to just say it's bad luck.
And this couple just lost a baby.
Yeah.
Yeah.
It's heartbreaking.
It's heartbreaking. Yeah, there's no compassion there, obviously.
That's right.
Yeah.
Bad luck.
True care,
Yeah,
true
bad
care
luck, yeah.
and no compassion
No
is what's
compassion,
happening.
Yeah. My husband and I decided to try again and became pregnant for the 5th time in March 2002. Before I became pregnant, we searched the internet and library for any information regarding repetitive miscarriages. We knew there had to be answers. When we lost our 4th child to miscarriage around my 7th week of pregnancy, we knew for certain that this had nothing to do with luck. Our doctor had no answers and referred us to an infertility specialist. We wanted to find a doctor who would find the cause of my miscarriages, so we searched out on our own. My sister taught natural family planning, and she had heard of Dr. Hildreth, so we researched the Institute. We were very excited when we visited the website of Pope Paul VI Institute, now St. Paul VI Institute. We immediately knew that we wanted to work with Dr. Hildreth, and we were hopeful that he would help us. We read about NaProTECHNOLOY and felt that it was an answer to our prayers. We began working with a practitioner of the Creighton Model Fertility Care System and charted my cycles. My husband and I had practiced the Billings method of natural family planning, so we were familiar with charting and were excited that there was a doctor available to review my cycles. Dr. Hildreth looked at my charts and advised us to have hormone testing done through the Institute and to schedule a visit to the Institute for a laparoscopy and ultrasound series. We were excited to begin this process and finally have answers.
How important is that?
Yeah.
Just to have answers for what's going on in their
Absolutely.
life. Like it's so much needed. It's even though sometimes maybe those answers might not lead the couple where they want, but at least it gives them some closure. It gives them some satisfaction,
Yes.
knowing why this has been happening.
Yes.
Not just bad luck.
Right. And, when Dr. Hildreth does look at the hormones, he looks at it as a profile, and he uses the biomarkers of the Creighton model chart to determine when to do those blood draws to look at those hormones. And it gives us gives him and the other medical consultants so much more information in doing that.
Yeah, so true. We met Dr. Hildreth the day before my laparoscopy was scheduled to review my Creighton model charts and my medical history. My husband and I were amazed when Dr. Hildreth looked at my charts and told us that he felt he would find endometriosis during my laparoscopy the following day. But we were even more amazed when he turned out to be right. 2 days after my surgery, we had an appointment with Dr. Hildreth to review my results from all of the tests. He told us that my endometriosis was pretty severe, but he was able to remove all of it during my laparoscopy. He also told us that endometriosis was a 50% cause of miscarriage. We were both very shocked because our other doctor had never mentioned this to us. Dr. Hildreth reviewed the results of my hormonal profile and found that my estrogen and progesterone were low during my cycles, which could also be contributing to my miscarriages. He also found that I was factor V latent positive, which is a blood clotting disorder, and that there were also some issues with my thyroid. We now had a list of 4 possible causes for the miscarriages. Dr. Hildreth told us he felt that we had a very good chance of having another baby because my endometriosis was taken care of and my hormones could be monitored and supported in subsequent pregnancies. Needless to say, we were very happy with the news. We discussed the progesterone and HCG shots and thyroid medications with him.
For the next couple of months, Dr. Hildreth monitored my hormones until he felt they could sustain a pregnancy. After 2 months, he told us he felt we could conceive. We were excited but nervous because of the pain experienced with our 4 miscarriages. I became pregnant in October 2002 for a 6th time. We were very supported by Dr. Hildreth and the Institute during this pregnancy. They monitored my hormone levels and ordered an ultrasound at 6 weeks. All of my hormone levels had been great and I had not experienced any spotting, so we were looking forward to seeing a heartbeat but instead we saw 2 heartbeats. Our doctor informed us that I was carrying 2 healthy babies and that everything looked great. We were so surprised and felt so blessed with the news. Dr. Hildress continued to monitor my hormone levels long distance and supported me through my entire pregnancy. I had a wonderful pregnancy with no complications.
On June 24th, 2003, I gave birth to 2 beautiful baby boys, Thomas and James. We felt the least we could do was name one of our sons after Dr. Thomas Hildress. Every day when we look at our boys, we are so thankful for the treatment that we received from Dr. Hildress and NaProTECHNOLOY.
4 miscarriages, a beautiful outcome, but it took 4 miscarriages to get to find the 4 causes of these miscarriages.
That's right.
But thank God for Dr. Hildress and the Institute who are dedicated to finding the problem.
Absolutely.
And working on solving it, and of course leaving the rest to God to decide, because He's the author of life.
That's right. And their practitioner for teaching them the Creighton model system, because they need, in order to practice the NaProTECHNOLOY, they need the Creighton model chart, and it needs to be accurate. So that's so important. That's why I love doing what I'm doing, to train practitioners.
Yeah, and if any one of you is interested in finding out more about practitioner and how to become, you can just check in the description below. I will have links to different websites that can lead you to different education programs. The world needs more people saying yes to this work, to this mission. So don't just dismiss it. Consider becoming a practitioner as you listen and watch these videos and as you listen to these stories.
I want to do one other insight. Clear back here in 2003 and 4, or 2003, Dr. Hildress was doing long distance monitoring of the pregnancy. That's how forward thinking he is. And he is always on the forefront, bringing new medicine in women's healthcare.
That's great. Yeah, I didn't know that.
Good
That's
point.
Great. Yeah, that's
Good point.
Thank you. Well, this is it for today, for this episode. We will be going through more stories, different categories, but this one is about miscarriage, so share it with other women who might need to know about the Creighton model and NaProTECHNOLOY. It's a very sensitive topic. It's hard really to talk to people about it, but you can just click share and you can get that message out to other people. Thank you so much, Teresa and Margaret, for joining me in episode 2. It's really exciting to have you.
It is exciting.
Thank you, Marise,
Thank
for thinking of this. We really pushed hard this whole week. We've been busy with 9 students. It's been a wonderful week.
Thank you so much for watching, and don't forget to leave your comment, any questions that you have in the description box below. And God bless you.